My cell phone number is on my answering machine.
So
I believe in that.
Will you call back right
Oh,
away?
absolutely.
Yeah.
If I get the call, I'll call back as soon as possible.
What is, all right, so a cavity is just decay in the tooth?
A cavity is decay in the tooth that forms as a result of bacteria that combines with sugar, and the sugar turns to acid, causes the cavity. Okay. Now, we put fillings in teeth.
Gold, there's a lot of
controversy. In the old days, it used to be the silver fillings, right?
Yeah. What's now?
Nowadays, we have these bonded fillings that are white in color. Now, the big question is, well, do they last as long?
And do they?
Well, the newer materials last just as long as the silver fillings do. But there are certain opportunities, there's certain situations where you might not use a bonded filling. You might use a gold filling. Or you might have to put a cap on a tooth because the tooth has become weakened. So there's many different ways. There's also these all porcelain onlays that go on teeth to hold the tooth together. There's nowadays, with the advent of aesthetics and the Hollywood smile, people are putting whitening or
bonding
or veneers.
Veneer. What is
porcelain
that mean?
Veneers.
Over the tooth?
Porcelain veneers are it's like I explain it to my patients, it's like a false fingernail. We trim a little bit of the tooth off the front of it.
And you do that in your office?
Yes.
Yeah.
We trim a little bit of the tooth off the front, if it calls for it. You know, there are some places, there are some situations that you can't do that for. But if you can do it, you trim a little off the front of the tooth, you take an impression, send it to the laboratory, and they make this little false fingernail-like projection piece of tooth that actually pastes on the front of the tooth. On the front of your tooth.
Does it last forever? And
I often tell this story. My first case I did in, I think it was, Maura would know the exact date. Maura was my first patient that I did veneers on. And I think it was, I want to say 1988.
Oh, that's a long time.
And Maura came to me, and she had spaces between her front teeth. And she told me that in a month's time, she was going to get married. And I said, oh my God. So I did it, and I crossed my fingers the whole time because it was the first case I ever did. And that case looks as good today as it did in 1988.
Is it supposed to last that long?
Oh, it should last a long time, a very long time. As long as you take care of any type of dentistry that's done, you have to take care of it like it's your own tooth. If you don't, then it's going to fail. And it's going to fail quickly. So the key is to get the patient to understand that they have to brush and floss, and we'll do what we can, but it's really up to you to make your investment in time and keep your teeth in good shape.
So two things, bad breath and an abscess tooth. Why does the dentist say, oh, you have an abscess? The cavity went beyond being taken care of?
Sometimes, you know, anytime you drill a tooth, whether it be for a cavity or to place a crown or to place to anything that you do where you touch the drill to the tooth, you injure the nerve of the tooth. Anytime. If it goes very deep and it goes into the nerve of the tooth, then we have a problem because it will cause an abscess. And an abscess is basically an infection. What happens is the nerve in the tooth dies, and it pools at the end of the root of the tooth, and the body takes care of it by trying to get rid of it, and that's what causes the infection. And that's what hurts.
And that's what the pain is. What about...
so what resolves an abscess tooth? I think that would probably be your next question. Well, what you have to do is you have to get rid of that debris that's inside the tooth that has become infected, and that's where a root canal comes in.
You said you have a specialist you send somebody to.
Most root canals I send to specialists. You know, the easier procedures like front teeth, for example, have just one root in them. It's a fairly straightforward job, and most generalists can handle that.
Do you?
I do a few. But I have such a good endodontist, that's who does root canals, that I send most of my work to the endodontist.
Isn't that wonderful?
They can do it much quicker than I can. They have the technology, because every specialty has its own technology. And they're able, if you these specialists can keep up with the most modern technology and the most expensive technology, where I can't. So I feel it's in the patient's best interest to go to a specialist that has this new technology and has been trained in that area to do that specifically. That's how I run my practice. So.
Do you mind giving needles? I mean, I mind getting them. It
Yeah.
hurts. I shouldn't say it hurts. If you get somebody who knows it cannot hurt, it can't hurt too.
You know, that was the hardest thing for me to do, was to give a shot. You know, I've become pretty good at it. People tell me that they don't even feel them anymore. But
Did you handshake?
not anymore. Maybe in the beginning. Not anymore. But you know, the thing that happened in your era, Phyllis, and in my early days.
Well, my era, yes.
We used to reuse needles.
Oh my.
They used to put them in the sterilizer and sterilize them, and we used to reuse them. And they got dull. So they hurt.
Oh.
Nowadays, everything's disposable. It's brand new. It's sharp. So, and it's smaller. So it doesn't hurt like it used to. But there are still people out there that are very fearful. That's when yeah. That's when I started. I started to look around for other opportunities where I could make the patient feel more comfortable. So I was trained in sedation dentistry. So I went to this this course called DOCS, Doctors of Oral Conscious Sedation, and I learned how to give pills to patients so that they can feel very relaxed when they come in.
And then you give the needle.
Then I give the needle. And I also use nitrous oxide, which is called laughing gas. You know, where...
Does it make you sick afterwards?
No, it doesn't make you sick.
Excuse me.
Normally, patients know that you're giving them a shot, but on my conscious oral sedation that I use, the pills that I use, it has an amnesic effect. So they don't remember.
And no
which
side
is great.
effects?
No, the key to oral conscious sedation and not having side effects is after the procedure is done, is to drink a lot of water. And I say that should be anytime you have sedation, whether it's in medicine or dentistry. If you drink a lot of water, the side effects from the sedation is going to be minimized. So it's great.
How is your office? Is it all these things, picks and all that? Do they, each one is for a certain thing?
Yeah, we have a certain set of instruments. Interestingly enough, as I've gotten more skilled, the less instruments I use.
Is that so?
Because you can use the same thing for multiple things. So that's what happens. You know, when we went to dental school, they made us buy all of this equipment, you know, to treat the patient. I think if the box was this big when I was in dental school, I think the box is more like this now. It's crazy.
Now,
and also materials have changed. So things have changed over the years. It's made it a lot easier.
X-rays. Dentists like to do a lot of X-rays, or they feel it's necessary to. The X-ray tells you everything. Is that it?
It's the baseline for how we determine our treatment plans. Now, again, when I was younger, we had conventional X-rays. And if you remember, the dentist used to scurry out of the room and you used to hear this buzzer go off. It used to be bzzzt, right?
Don't they do that now?
Well, we do it.
They put that piece on you.
Yeah, they put the lead apron on.
Yes.
Well, we do it, but we use digital X-rays now. So instead of hearing that bzzzt that you used to hear, digital X-rays use much less radiation. So you'll hear a bzzzt, and that's it. Digital X-rays are amazing. It's a sensor that we put in your mouth. It's not those films that hurt a lot.
I could never get them in. My mouth was too
so small. Well, sometimes the sensor's hard to get in too. But the sensor goes in, and we take the X-ray and then we move it. We don't have to change it. It just, the sensor is used throughout the mouth. It's great. And then the X-ray itself comes up on the computer terminal on the monitor, and you can make it big. You can blow it up however big your monitor is. You can blow it up the size of a 42-inch TV if you want to. So it's great, and it allows us to diagnose better, and it uses less radiation, as I said. It's just a much better way to diagnose a patient than the conventional X-rays are.
So you must want to see children so you can start off, or not children, or a young adult.
Well, I recommend that parents get their kids to get into the dentist, whoever it may be. If they feel more comfortable going to a children's dentist, then that's where they should go. But they should start 2
Yeah.
years old, 3 years old. They're starting as young as 2 now. Used to always be 3. But you want to get them used to the dentist. You don't want to have them scared of the dentist, because those are the hardest people to treat. Are those people that were, you know, I hope I never caused this for anybody, but, you know, the scared patient is so hard to treat.
What do you do if you have somebody who's terrible? Do you give them
I try to talk them into sedation. That's what I try to do.
Yes.
Yeah, because sedation is a way for them to get through the
5
difficult
minutes
part.
they're giving me. That's Casey's giving me the sign.
5
that we
minutes.
have 5 minutes. You've
Isn't
given
that
us
something?
a wealth of information
Thank you.
on all the things, and I hope you'll be our resident dentist that in 2 or 3 months you'll come
I'd love to
down
do that.
and tell people. You have your own practice. How many rooms do you have? How do you do your hours? Are you there every day?
Yeah, most days. I work a lot of hours. Well, I'm there a lot of hours.
Are you open every day?
Every day except Sunday. But you know, there are some days I'm not for holidays and
Yes.
for my military duty. I can't work this Saturday that I have military duty,
I
because we
think
go
that's
once a month.
commendable.
But I do have one Saturday a month that I work. I have nighttime hours, evening
you do?
hours, and I have early morning hours.
Oh, what's early morning mean? Before you go to work, 6, 7?
I start at 7.
That is excellent.
Yeah, start at 7 on Wednesdays and Fridays.
What about evening hours?
Evenings are on Mondays. We work till about 7:30 at night, 7:30, 8 o'clock, depending on what's going on that day.
Do you mind looking in people's mouths? Of course, that's a silly question. You're a dentist, but
Yeah.
isn't it sometimes awful?
Not too bad.
You tell people when their mouth is gross and how to clean up, I hope.
Well, unfortunately, the worst patients I've seen are soldiers.
That's what everybody says. Why is that?
Well, a lot of times I see them after they've been out in the field for a week and they haven't brushed their teeth.
Oh, God. In
It's not
Iraq,
that-
you're talking?
Well, wherever they were.
Wherever
Yeah,
they
wherever
were.
they are. And you know, the other issue is some of their habits are not that great. So not only dental habits, but maybe they went out on a bender the night before.
Oh, God.
And that doesn't.
But you
that
try
doesn't
to
bode
change
for-
things, don't
I
you?
try
Teach.
to. Yeah. No. Most of dentistry is education. You know, you have to educate everybody so that they know what's going on.
We have 2 minutes.
All right.
What haven't we covered, Dr. Wolfert, that you want to get? It's been marvelous. We've covered it, I think, everything.
Yeah, we've covered a lot. Let me think a minute.
Okay, but people could come to you. They could. What's your telephone number? I'm sure they're putting it on the screen.
Yes, my telephone number is 781-335-0604. But if you want to know a little bit more about my practice, please visit my website, which is toothboss.com. And we're in the process of refining that a little bit. And hopefully from this program, I'll get some CDs that I can put on there.
Absolutely.
Well,
they're going to give you one now. Jeff and
upgrade.
Casey are the best. And I think people, even though we have to go to the dentist, we don't know a lot about the mouth. We don't know a lot about dentistry.
I think most people don't. And that's where I think my skills lay. I like to educate people to a lot of different things. You know, what they need for treatment, certainly, but what their benefit will cover and how insurance works.
You take a lot of insurance?
I take the bigger insurance companies. You know, Delta Dental's one of the biggest. Blue Cross Blue Shield's one of the biggest. And I also take TRICARE because I want to service the veterans and
that's
soldiers.
Wonderful.
You know, because obviously I do that anyway. So I try to give them the best of my knowledge. So.
Does Scott Brown know about you? I have to wrap it up.
Scott Brown.
Dr. Wolfert,
Thank
you
you
so very much. You're in Weymouth, you're local, you have your own practice. People meet you one-on-one.
Yes, I'd like them to come in and meet me. In fact, we have this thing called meet and greet. If you just want to come in and talk to me and figure out if you're a fit for me and my practice, please come in.
That is wonderful.
Yes.
That is wonderful. We'll have you back for many years. As long as I can talk and Jeff and Casey aren't sick of me, we will be doing this.
Thank you,
I
Phyllis.
thank you
I
very,
appreciate
very
it.
much.
Thank you very much.
Bye-bye for now.
See you later.